right, so we have our patient, Mr. Moose here. He received 1 unit of packed red blood cells earlier, and I noticed he had increased shortness of breath and fine crackles bilaterally, so I notified the doctor. The doctor ordered 40 milligrams of Lasix via IV, and I have 10 milligrams of Lasix per 1 mil available to me, so I will give 4 mils of Lasix via IV for Mr. Moose. And I would also ensure before I give it that I follow the 5 rights of administration: the right patient, the right dose, the right route, the right time, and the right med. And I would also make sure that I know any contraindications or any other side effects or adverse reactions that could occur with this med and what to monitor, such as I would monitor their patient's blood pressure. I would make sure to monitor their labs, such as their CBC, their liver function, and their BUN. I would also make sure to monitor for signs of electrolyte imbalance, such as nausea, vomiting, dizziness, muscle weakness, fatigue, arrhythmias, things of that nature. And I would also tell the patient to notify me right away if he's experiencing nausea, muscle fatigues, vomiting, anything of that nature. And I would also ensure to tell him to request assistance before ambulating to help prevent the risk of falls. I also, you can see there, and then I also would make sure to introduce myself to the patient. So, hello, Mr. Moose. My name's Caitlin. I'll be your nurse today, and I'm going to explain to him why he's getting the med. It seems like after we gave you your blood infusion, we have a little bit too much fluid in your body now, so we're going to give you this medicine called Lasix to help you get some of that fluid off, and you'll excrete it through your pee, so you might be peeing a lot, but we'll monitor their input and output closely as well. And we would also make sure to let me know if you are going to get up and walk, and let me know if you're experiencing any muscle weakness, fatigue, nausea, dizziness, anything like that, because that could indicate that you're letting off too much fluid. Then I would have the patient state their name and date of birth for me, and he would tell me he's Mr. Moose and his birthday, and then I would check his wristband versus the MRON to also ensure that it's the correct patient. And then I would provide privacy, and I would wash my hands, and I would set up everything I need in the order that I need to use it. I only have 1 syringe today, so it's going to be, I will explain to you what I'm doing as I'm doing it. So I would start out by washing my hands, and then I'd apply gloves, and then I'm going to scrub the hub for 30 seconds. And then after I scrub the hub for 30 seconds, I'm going to wait for it to dry. And then after it dries, I'm going to take 3 to 5 mils of normal saline, and I'm going to flush the line to ensure patency. And I'm not having any resistance here, so the line is patent. And then I am going to draw up the 4 mils of Lasix, which would equal 40 milligrams because it's 10 milligrams a mil. So that's 4, and I'm going to give it over 1.5 minutes. You can give it between 1 and 2 minutes. So I'm going to scrub the hub again for 30 seconds and wait for it to dry. And then I am going to administer the Lasix over 1 minute 30. And I also do not have a watch in my house or a clock, so I'm going to be counting in my head, just so you're aware. Okay. Alright, then I would disconnect after I administered it. And then I would make sure to drop 4 mils, which is the same amount of fluid, and as the dose of medication I just give, and flush at the same rate. And also, when I looked in the drug book, it did not say that Lasix needed to be diluted. So I'm going to scrub the hub for 30 seconds, let it dry, and then I am going to flush over a minute and a half again with normal saline. And I would disconnect after administering it. And then afterwards, I would make sure to discard of all of my materials that I use that need to be discarded. And I would remove my gloves and perform hand hygiene again. And then I would continue monitoring my patients for any signs or symptoms of an adverse reaction or any side effects that could cause issues with them. And I would make sure to document everything in the EMR. And that is all.